Good morning. Welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Doing really well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your public health, COVID, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing a viewer-submitted question, the latest headlines, and our lone U.S. COVID statistic through today, August 9th. We invite you to submit any questions or suggested topics down below or via our Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day reached 60 daily. In the same week in 2023, we saw 77 deaths per week. Dr. Murphy, your reaction to that number?
Well, this is the only metric we're really following in a very hard way. It's definitely increased over the last couple of weeks. It's down in the low 20s there for a while, but the other unfortunate thing is that we're almost at the same numbers that we had a year ago. The point is COVID is not going away, and it's still killing people. At 60 deaths per day, that's 22,000 per year. That's a lot of mortality. So COVID hasn't gone. COVID can cause trouble, and please keep up with your vaccines. The next vaccine will be out in about a month or so, and it's geared towards the Omicron viruses, which are in the population now. And please consider taking that along with your flu shot, which is always updated every year anyway. So an updated COVID shot and flu shot will help control these numbers.
Absolutely. And before we move on from COVID, we received a great comment on the study we reported on last week. It was that massive English study looking at the lack of cardiovascular events that came after COVID vaccination. The comment read, regarding the England data, it clearly goes against the increasing public sentiment that vaccines are an apparent cause of cardiovascular events. It would be good to have both the data reassessed by an independent researcher and bring the study forward to 2023 data. While we can't do that immediately, do you have any other data sets that you can share with us regarding COVID vaccines and cardiovascular events?
Well, this perception that the vaccine causes heart attacks is very unfortunate because the data, if you look at actually hard data from any system in the world that collects this data, the opposite is true. These numbers are enormous, looking at, in the one case, 31 million patients followed. And they found that from the beginning of the pandemic, acute myocardial infarction, that's heart attack, decreased. When the vaccines rolled out, it continued to decrease. Overall, just because of the improved healthcare treatment and prevention for heart disease, the numbers of acute heart attacks have declined 1 to 5% per year anyway. And if you just look at all this together, the vaccines have not caused any increase. They've actually caused a decrease because COVID itself can cause heart problems. So it's just a pretty rich data set here with over 31 million people studied, and multiple studies have shown kind of the same thing. But, heart myocardial infarctions have gone down, not up, with the vaccines. So it's just, it's reassuring to see a data set this large that shows that once and for all.
Mm-hmm. And we agree, we want to see more of them. We want to keep getting that updated data and those data sets, and we will continue to seek those out and report on them. But shifting gears to our headlines this week, New published research sought to find if a previous RSV infection, can impact the severity of a later COVID infection. RSV, COVID, how can they relate? Can you tell us what the researchers found?
Yeah, what they found was that if you had RSV infection in the past year and then got COVID, your COVID was much worse than if you didn't have RSV. And this is controlled for all sorts of factors like age and whatever. So we know that RSV is particularly severe in older people, particularly people over 60, and in young children under a year of age. So the older people they found, and these are, again, really large databases. They found that 18,000 people out of 8.5 million individuals had a recorded RSV infection in this one study done in Korea. And nicely controlled studies showed that the incidence of COVID was higher in the people that had RSV previously in the year. They had more severe disease, more hospitalizations, and more deaths. So it just sets you up for a worse outcome with COVID at any stage of the disease.
Mm-hmm. And another reminder.
The point is another reason to take the RSV vaccine.
Exactly what I was about to say. If you're eligible, talk to your doctor.
In RSV, and so then when you do get COVID, you won't have as severe disease. So,
Now, looking into the H5N1 avian flu, a big topic over the past few months and weeks. More tests have come out of Colorado showing infected dairy herds, and there have been additional global cases as well. Can you tell us about these specific Colorado tests, and then just a general update about what's going on elsewhere?
So Colorado is reporting a lot of their herds of cattle having avian flu. They've had 9 outbreaks since late April. It's in the United States, in all, there's been 179 outbreaks in 13 states. The most reported state is Colorado, I believe. In particularly hard hit is Weld County, which is north and east of Denver, I believe. But the good thing is that the cases have been animal milk, in particular, to man. And they do have a higher incidence of conjunctivitis. The eye gets inflamed from the virus, which is a little different from most flus. But anyhow, worldwide, it's also a problem. There have been cases reported recently in Cambodia in children who were in contact with dead poultry. Some of the kids have been hospitalized, but so far, no deaths. The virus is mutating somewhat, but it still hasn't gone human to human. So what is there to do? We need to follow this incredibly closely and screen the dairy workers. There's some 200,000 in the United States alone, and to follow them closely to make sure that it doesn't mutate and into the point where humans can spread it to each other, which is totally possible. This is the big concern. There's a lot of criticism at how this is being handled at the public health level, and that we're not doing enough right now to even predict, even measure how much problem is even going on out there. But anyway, we'll talk more about that later. But this was a nice update on what is the status of avian flu right now. It's not going away.
And another infectious disease, it feels like we have been shouting on the rooftops about lately, is Mpox, formerly known as monkeypox. There has been some action from public health agencies in the fight against global monkeypox and Mpox. Can you tell us what they're doing?
Yeah. So last week we reported that the number of cases of Mpox is increasing in Africa. They have a different type of Mpox than we have here in the United States and in Western Europe. But and their Mpox is more severe. That's basically type 1, clade 1. And for instance, in Congo, which is the country that's been the hardest hit, 12,000 people have been diagnosed with Mpox, mostly children. 470 have died. That's 4% mortality rate. 2/3 of those cases were in kids, as I mentioned. So this is very worrisome. And up until last week, there had been no financial support to really fight this pandemic, despite the fact that there's a preventable vaccine that's out there. The Jynneos vaccine works no matter if you have type 1 or type 2. And there's been nothing. WHO just committed $1 million from its emergency fund to deal with the response to Mpox in Africa. That's a drop in the bucket, considering how big Africa is and how many countries are involved, but at least it's a start. One of the WHO's leaders, Maria Van Kerkhove, was quoted, "We do not want the world to sit, wait, and watch. The time to act is now." So this is just another disease that's got to get under some control, and it's totally preventable.
Mm-hmm. And just to be clear, the health agencies, public health agencies on the continent of Africa have been doing lots and lots of work to try to fight against Mpox. Not trying to say that they have not. So they have been doing the work. And we hope to continue to see that work.
Well, and even in the United States, the high-risk groups, only 25% of them have taken the vaccine. It's just amazing how poorly this has been rolling out and accepted, even in a high-risk population.
Absolutely, and that points out another disparity in which here in the United States, we have most of the global supply of that Jynneos vaccine, and yet only 25% of the at-risk population has received it.
These vaccines you can't keep forever either. They have expiration dates, and we might as well use them while we have them, and we can make more.
Mm-hmm. Absolutely. Now, last week, the Pan American Health Organization issued an alert regarding Oropouche virus. Can you tell us what it is and why the alert was issued?
Well, this is another virus that popped up here, mostly in Latin America. Oropouche, it's spread by midges and mosquitoes. And it can cause fetal deaths in pregnant women and all sorts of fetal problems, kind of like Zika virus, if you remember. So at least 8,000 confirmed cases have been confirmed in Bolivia, Colombia, Cuba, Peru, and Brazil. Brazil has the most number of cases. Brazil reported 2 young women, ages 21 and 24, died from this disease. The symptoms are kind of typical of these viruses. I mean, fever, muscle ache, pain behind the eyes, headaches, vomiting, and more. And it can cause death and problems with the pregnancy, as I mentioned. So that right now there's no vaccine or specific antiviral drugs to prevent or treat these infections. It's a strictly symptomatic treatment, which is not good. Symptoms usually start 4 to 8 days after a person gets bitten. And the disease itself, if you get it, tends to last less than a week. But can be a little bit longer. So anyway, this is just another thing that we're on the lookout with thousands of cases and possible death. So with no treatment at this particular point, but it's now at least getting some attention.
Mm-hmm. Another reminder to wear your bug spray.
Yes.
No mosquitoes, please. Now, our final story for today follows a new CDC report analyzing the impact of their Vaccines for Children program. Can you tell us about the report and a little about the program itself?
Well, kids are offered a variety, and adults are offered a variety of vaccinations to prevent deadly diseases. Diphtheria, tetanus, pertussis, Haemophilus influenza, polio, measles, mumps, rubella, hepatitis B, varicella, which is chickenpox, hepatitis A, strep pneumonia, and rotavirus, which causes diarrhea. So they did an analysis of the impact of the vaccines on the populations, and showed that if the vaccine programs have prevented hundreds of millions of illnesses, tens of millions of hospitalizations, and more than 1 million deaths just in people born 1994 to 2003. And so it is really just amazing, how much disease has been prevented by these vaccines. If you look at the number of hospitalizations, the biggest impact was in measles, which prevented 13 million hospitalizations worldwide, and including many in the United States. And for deaths, diphtheria was the most lethal. It prevented 752,000 deaths from that. And if you do a cost-benefit analysis, besides just all that disease and death, the impact on society was over $500 billion in direct medical costs worldwide, just treating these infections, and 2.7 trillion in societal costs, such as people missing work because of being sick or taking care of a sick child. But anyway, it just is a huge scientific report that shows what the benefit of these vaccines are. That these vaccines, many of them have been available for decades, and having this incredible positive effect. If you don't take the vaccines, you don't get the benefit, and you may pay the price.
Mm-hmm. And on that note, Dr. Murphy, I'd like to thank you for your time and your expertise joining us for another episode of the Ask Dr. Murphy series. Thank you very much.
Well, thank you.
And thank you all for joining us for another episode of the Ask Dr. Murphy series. We hope to see you back next week. As always, if you have any questions, comments, or suggested topics you would like to see addressed, please leave them down below or at any of our social media linked in the description. We'll see you next week.